On the physician side, we've been using AI beyond just ChatGPT, open evidence, which we've talked about last time too, to ask questions, get information. And then ChatGPT Health realized, we've known for a while people have gone to Google, right? We go to Google for all our health questions anyway. ChatGPT Health realized, hey, give us all your patient records, everything. We'll synthesize it for you. Okay? Similar to what I may or may not have done this past weekend with all my taxes. Before I showed my accountant, I'm like, hey, I gave ChatGPT all my tax paperwork, said, I trusted it. You know what? You have all my records, but you probably have access to all my records anyway if it's on my computer. So, and I said, what should I be asking or not asking my accountant? What should I be expecting? What is a good strategy here? And so ChatGPT Health was the first, I believe, to do this. What separates Amazon is that not only is it going to synthesize information, they're going to give you healthcare access to the tele platform right away. I think that's huge. I really believe that if they can not only synthesize information, but then say, hey, okay, this is what we think we're going on. Here's a human in the loop now, right? You talk about the human in the loop. Now we're going to give you access to a televisit probably instantaneously. I bet they can, if not now, pretty soon, instantaneously. That's powerful. That I can imagine not only for initial primary care, but for second, third opinions. You can do a lot with that information. The other ones, I believe their angle will be soon to partner with organizations. I bet Copilot's going to do the same thing. The money here is not only the patient visits, but the data. Can you imagine all that data? I mean, that data then, in a non-cynical way, being sold to pharmaceutical companies or other modalities. That's powerful. I think the data will probably be more financially lucrative to these companies than even the patient care.
Matt?
I totally agree with that last part. I think the biggest thing you see from ChatGPT Health, and I could see this being Microsoft's angle as well, they're really solving the data interoperability problem that's never been solved before. There have been many efforts to get patient data from all these different angles and to bring them together. There have been whole startups founded and since gone that were trying to get patients to upload their data to be a good repository for your healthcare information if you ever need it again. But I think the consumer experience for ChatGPT or Microsoft Copilot is so compelling that patients are willing to input their most personal and sensitive healthcare data. And it does strike me that that's what I think a lot of these groups are now springing up to try to do, is get a piece of that data aggregation, because to your point, Neil, it's going to be valuable. So I see that angle, and then I think you're spot on with the actual care delivery. Amazon's definitely unique through the acquisition, not just of One Medical, but they also acquired a company called PillPack, I think back in 2018. And so they've been kind of playing in this, the pharmacy and the distribution space when it comes to healthcare for quite some time. And yeah, I think it'll be fascinating to see what some of these other companies can actually layer on top of just the data analysis.